So yeah, I confessed to Tiago just before he let the rest of you in the room that I sort of re-engineered my talk just today, partly because I didn't think it was up to snuff, and I thought there was more interesting things I could say. As Tiago's already said, I'm not exclusively a healthcare researcher. I come from a sort of checkered past of working on different projects, but I've always had an interest in healthcare technologies, but very much from that sort of human-centered approach, and I work very collaboratively with people. And in fact, that's another confession for today as well. The work I'm talking about today is not just mine. This is work that actually is resulted from extensive collaboration with a really talented group of people, Tiago included, and others on the call as well. I see Andrea and Diogo as well, and many more. I'll try and make sure that I give credit where credit's due as I go. But as I say, that these are the sort of collective efforts of the team, which is always nice to sort of share. And then the other side to this as well is that actually this democratizing healthcare technologies, actually this was a conversation that Tiago and I started many years ago, and it sort of evolved back and forward between the two of us, and we've sort of chipped away at this this sort of vision for what we think healthcare technologies could and should be, through small little elements of other projects as well. But today I'm going to get a chance as well to talk about the first real funding that we've secured to really push this forward as well. So this project around Parkinson's, and I'll use that as a bit of a case study to hopefully give a bit of structure to, as I say, the sort of vision for what democratized healthcare technologies could and should be. I already apologized at the start if there is interruptions, so sorry. Please, somebody just notify me. I'll keep an eye on things if there's a hand up, and I'll try and sort of prevent those disruptions too much. And likewise, if you've got questions throughout, I'm happy to take interruptions. That's never a bother. Yeah, so before I start, as Tiago mentioned, I'm from human-computer interaction, so I'm very much interested in human-centered design. I work on a broad range of projects and topics, not everything in the healthcare domain. More recently, I've definitely done a lot more in sort of health and social care. However, for me, what I'm really interested in is the way that we sort of design and configure these technologies, and how we use technology in sort of unorthodox and interesting ways. And as a result, I get to collaborate with a lot of different people. So some of the examples on the screen are projects that I've been part of. You know, we've done things from small-scale bespoke pieces of digital jewelry right through to large-scale systems and infrastructures that we've tried to roll out, and some genuine interventions that we've sort of put in place. So some of the healthcare technologies we deployed in Lebanon with refugees and whatnot. So I've got a sort of wide range of experiences and skills. And I think, you know, I always struggle to try and see, well, what is my path and my value in these projects? And I think, you know, it's sort of trying to pull on some of those things that we do and see how that might also be useful somewhere else. And sort of that process of how we think about the tooling and the processes in which we involve our participants in the design of these systems and technologies. And that's very much the sort of mantra and the focus for me in my research is that I want to be working on meaningful things. I'm really interested in these sort of critical social challenges, and I'm really interested in not how I harness the power of digital technologies, but actually how do I support others being able to sort of channel and use those digital technologies and services as a way then to address the sort of challenges and problems that they're experiencing as well. So I work very closely both with, as I say, collaborators in other disciplines, but also very hands-on with participants themselves to try and tackle these design challenges. Yeah, so today in particular, though, I'm going to try and keep the focus on healthcare technologies. And as I say, this sort of evolved out of some thinking that Tiago and I had, where we sort of looked at the way that we played with technology and the way that we tinkered with technology, and the idea of you know, how could we start to think about these healthcare technologies not being something that actually are sort of used by us as technologists and researchers, but actually how might that sort of tinkering, that self-exploration and play be something that the individuals themselves living with these lifelong and chronic conditions, the things that they start to sort of do for themselves. In the field of HCI, we always recognize that actually the participants, the users that we're working with, they are expert in their own right, and they bring something to the table. And I think we've always got this weird sort of power imbalance when we think about the design of technology and when we conduct research, in that actually we satisfy our agenda quite often, but not always theirs, or theirs is sometimes compromised, you know, in order to ensure that we can sort of do the research we do. And really what we're interested with this and with this sort of larger framing of work was around actually, well, what if we could change that balance? What if we could adjust that imbalance, and what if actually we could give over more agency then to those individuals, and what if they themselves could start to be champions then of the designing their own healthcare technologies and interventions? And this is an interesting strategy when you think about the sort of push and the desire for us to move more towards these sort of personalized approaches to care and management of health as well. Well, actually, who better to design for you than yourself, as long as we can provide you those sort of tools and those infrastructures to allow you to do that. So that was a sort of the general nuts and bolts of that conversation that we had over coffees many years ago, and it's been something that sort of keeps sort of steering us and directing us down this path. So I've got a very simplistic representation of how digital innovation happens. This is sort of loosely based on some of the work you might have seen around these sort of speculative design and these sort of possible and plausible futures. So if we take, for example, here our sort of what is possible with digital technology. So if we start at the point of that invention of that new technology, that innovation, what is possible is really open. There's a lot of scope and a lot of flexibility. And then as we start to progress and we start to sort of make decisions and refinements to that technology, what we see is actually what is possible starts to sort of diminish quite significantly. And instead we sort of find ourselves at a particular target. We're aiming for something. And this is the way that most digital innovation tends to happen, and it's because actually a lot of the time, these things are within sort of small groups. It takes that specialist knowledge, that specialist understanding in order to work with and use those. It takes a long time before these things start to open and include sort of wider groups and those analogous communities, and then a longer time yet before these things maybe even appear in sort of consumer technologies or products that we experience. And by that point, they're so refined and directed at something that actually it's very difficult to imagine them doing anything beyond that. For a lot of us, we look at these things and we might think, well, great, that's perfect, that's exactly what I needed, that solves that problem I've got. And we're the lucky ones that share those problems with the visionaries that came up with those technologies. But actually, just as there's few of us that actually these things work out well for, there is a large population of people who actually needed something completely different. And the danger you've got by us following this sort of very simplistic way of thinking about digital innovation, the way that we create things, the cutoff point at where it's possible then for us to pivot and redirect our attention and to achieve those things is much earlier in that process. It's much earlier in the sort of design and innovation stage, and it's not necessarily something that's accessible to a wider range of people. Typically we would think about, when these things start to appear and become available to mass consumers, at the point where they're almost done. There still might be these tweaks and updates and things happening, but for the most part, it's a rounded off product. So what we're interested in here then is through some of this sort of re-engineering or tooling, or through alternative approaches to how we design technologies, can we reverse time? Can we find a way then to revert back to an earlier point where there was more potential and more scope or more wiggle in the sort of the definition then of those systems, those technologies, those innovations, such that we could imagine, these either projects forking from it, or this idea of opening up new avenues and new directions for that technology, ones that don't require us going all the way back to the start and starting again. So what we're really interested in is saying, well, can we bring the users further into this and earlier into that process? And in order to do that, then we need strategies and tools and ways of working with then those potential users of those technologies. And this is not something new that I've just invented. This is strategies that we see being used. It's not necessarily strategies that we see being used and adopted widely, particularly in the sort of commercial sector, because it's very time consuming and costly. But actually, if you look at a lot of the work that goes on within human computer interaction research, then we would argue that we do a lot of this already, this idea of that human-centered design. So apologies if I'm sort of speaking to the choir here, as it were, but I thought it may be useful just to sort of talk about some of the strategies and techniques that we use. So a common one that we talk about when we do is human-centered design process, and you might be familiar with this as well, is this idea of the double diamond. Yeah, so what we have is these sort of phases that we think about in terms of that design and development process. So that first phase is that sort of scoping out and trying to identify then the problem. So scoping the problem and trying to really understand what is the challenge then that we're trying to solve. So what is the intention then of our healthcare technology? What problem does it try to take care of for us? So we've spent time in this space sort of researching, working with users and potential users, or building on top of, as I say, existing research and literature to try and drill down as to what that problem is. So sorry, widen out and understand in detail what that problem is. And then we shift into a phase of focusing in, okay, so that's a really wide challenge. It's going to be difficult to build a technology that does all of those things. So instead, then we start to collapse and we focus in on the particular key challenge that we're looking at. This is the problem that is top priority for everyone, the one that we need to address and solve. It's definitely not the one that we're just more interested in doing. It probably is. But the idea then is that we focus in on a particular aspect of problem. And then at that point, we start to widen up again. We start to then open our eyes to thinking about then the potential solutions, the way that we might start to work towards tackling that. And how might our new technology that we've been inventing, how might that become part of that process? And how can we innovate around that to create something new, a new healthcare solution? And again, a phase of widening, looking for new inspiration, drawing on those things, and then a phase of focusing in again. And all the while, every time we focus in, both in the sort of problem scoping phase and also here in the technology phase, we're doing this based on us making decisions. And every time we make a decision about one thing being included or something being excluded, we're potentially then either saying that, yes, that's within the remit of what we're going to look at, or this is totally outside of scope. And therefore, we're sort of cutting off any future possibilities that might have followed through that arm or might have existed down that path. So by closing as we do, as I say, we sort of limit then what is that potential future wiggle further down the line. And as I say, this is a common strategy we see right through. It's definitely to some degree something that you'll see happening as well with most products. And in fact, in some cases, even when these things are live systems, they still like to use people as guinea pigs and test these things on us as well. But I think the interesting thing here is around actually how we approach this and who has that control and that power. It still is very much in the sort of remit of us as the designers, developers, the technologists, to make those decisions. And even when we are working with users, we try our best to accommodate them, but actually sometimes it's impossible to accommodate everything. We have to make a decision. If there's one thing I know, it's that developers love very loose and vague technical requirements of systems. That makes it really easy to build software. Definitely not. So we need to refine. At some point, we have to make those decisions and we have to close in. But in doing so, we're accepting that actually this solution, isn't necessarily going to be viable for problems down that path or taking us to that possible future there. So as I say, we sort of accept these as we go. Now, by the time we get to that end point as well, that's the trouble we've got as well, is when we hit that sort of development phase and we're starting to build technologies and then refine how those technologies function and work. By that point, the wheels are in motion. We've made a lot of decisions. We've potentially invested a lot of time and resources in this. We're pretty much set on the fact that this is what the technology has to be. Like most things, it's hard and expensive to start again or to go back and change these things. So although you do get sort of closed loop cycles, and again, something that's encouraged in human-centered design, you do get to a point where actually you say, right, we can't really go back and change the following. We're too far gone. So again, these sort of limitations or issues that we experience then through this digital innovation mean that actually we have to funneled in and close the door very early on. And this is particularly true as well if you think of digital technologies that require hardware components. Software is great and it's very flexible, but hardware, we have to make decisions quite early on and often in order to sort of satisfy those sort of manufacturing pipelines and whatnot as well. So. And in fact, yeah, on that, the hardware side of things is incredibly tough. So I just want to sort of shine a light on this paper. This is some work by Steve Hodges and Nicholas Chancel from Microsoft Research. I think this was published in 2019, but something that I've talked about a couple of times with Steve through earlier collaborations. And one of the things that they explore and they talk about in this work is when we think about digital innovation in hardware in particular, there are tremendous challenges and barriers in order to transition from a prototype that we have. So if we are sort of creating a brand new novel prototype of a healthcare technology, in order to get from that phase into large scale product manufacturing and this thing existing, there are n number of complexities with that. These things don't just seamlessly translate. It isn't a pipeline as much as you'd love to think it is. It's definitely not. And one of the things they talk about as well in terms of this sort of long tail hardware is this idea that, in addition to us thinking about and having these products that we see that are, large scale, high demand, sort of focused products that, that fit to our economic models, fit to the way we think about scaling up manufacturing and producing these devices. We have a lot of things that exist in that long tail, these more niche things that are bespoke and more personalized. And that area of hardware is probably where we're going to find some of those really interesting golden nuggets and innovations around actually how we address and do deliver on that personalized healthcare. It's not necessarily going to be something that is a sort of generic one size fits all consumer solution. It's probably going to sit somewhere in that long tail. So what they talk about in this work actually is sort of some of the challenges and the barriers and a sort of call to action around actually how we need to rethink our approaches to how we sort of transition in hardware and how we scale up sort of manufacturing process. So they talk about this idea of having stronger communities, this sort of tighter integration between partners, so some more open relationships between people around how we build and do things. Improvements around obviously the sort of teaching and tooling of these materials and the availability of then the sort of software and techniques then that are needed in order to think about and innovate with hardware. And then the other interesting one was around these sort of new manufacturing solutions for small batches. So what they talked about was this idea of sort of more modular designs, and could you reappropriate things? And again, this is not necessarily something brand new and novel by them. We've seen some examples of that sort of modular constructive approach to technology. And in fact, for most people in the room who tinker with technology, you'll be familiar with development toolkits like Arduinos and Raspberry Pis that embrace that type of approach and allow us to sort of quickly prototype and model things without having to always go off and bespoke build or buy these PCBs, these sort of dedicated sensors and hardware. We've got sort of tools that are available and accessible to us that allow us to experiment with that and do these things. And actually what they're saying is that we need more of that further down the manufacturing process as well. So if you think about the sort of fabrication and molding that might need to go into a device in order to sort of package it and make it sort of safe for use and things as well, do we have similar sort of modular approaches and toolkits there? In addition to what they talk about in this paper, I would also add that we need a few more things. So one of the things that I think, and others that we sort of talk around this project as well, we think actually sort of benefits this, is this idea of sort of viewing hardware more in line with the way we think about software as well, and the approach we take to software. So this idea of open source projects and software is definitely nothing new. We've had it for decades. We're starting to see more and more of that in the hardware space as well. And again, this would speak to that idea of those sort of stronger communities, that tighter working together. In addition to that, is there ways that we might think about that reappropriation and reconfiguration of existing pieces of hardware as well? So rather than always thinking that we need to go and create something bespoke and new, is it this idea that actually we can find new value in those existing products and services, and can we re-engineer them, and do we have the tools and the access to do that? And if we start to think in that way, then perhaps what we can start to see then is create a sort of higher potential value in some of that long tail, and make that a bit more viable for these types of technologies to exist as well. But equally, by doing this, we potentially allow ourselves longer in that innovation pipeline to really decide on what this technology is for. So actually we can sort of reappropriate that to fit for something else. And as I say, that's definitely a sort of trend and a pattern we see happening quite a lot in software and in sort of research in that space as well. I'm guilty of doing some of that research myself. So looking at how we sort of reappropriate and reconfigure these existing platforms and services. So what we want to see as well is something similar around the way we think about hardware. And this, as I say, is a sort of interesting route forward to how we can potentially achieve these sort of democratized technologies. Oh yes, I'm supposed to round it all off into a nice clean vision and make it easy and digestible for you here. Let me try. So in terms of democratizing healthcare technologies, what we're really talking about then is giving over that access. So it's not enough that I have access to play and think of these things. The idea is that we want anyone and everyone to be able to have that, to afford them that luxury and that ability. So how can we empower, in particular, if we think about people living with these chronic conditions, so if we take something like Parkinson's disease, how can we empower everyone living with Parkinson's disease to actually, use and wield technology, like any other tool or material, in the way that sort of is best for them, to allow them to have the sort of greatest possibility then of creating something that actually improves their quality of life, or helps them to better manage and understand the condition, or to learn and explore for themselves, rather than what we have at the moment, which is a bit more transactional, whereby it's designed and dictated and applied to them. So actually, can we sort of, in some ways, rebalance the relationship between us as digital innovators and researchers with then those end consumers and users, and think of them more as those prosumers, or producers, consumers of these technologies. And in fact, the goal I always joke about is, eventually I want to do myself out of a job. So if we do a good enough job of this, and we make these technologies so easy and accessible that anyone can do it, then why would you need me anymore? Why would you need me doing these research projects? Everyone would just be doing it for themselves, and that's the ultimate goal. So it'd be nice to achieve it, but hopefully not before my retirement. Otherwise, my wife might be a bit pissed off. Okay, so in terms of some of the inspiration for this work, yeah, so I've got to give credit where credit's due. So I myself have a chronic condition. So I have arthritis, and I've experienced sort of arthritis and pain in my joints for a number of years. And as a result, I've been really interested in these sort of support groups and these community groups. I do a lot of self-experimentation. I take advantage of the fact that I am a technologist, and I try and do things myself. One of the community groups that I came across was this group here called Patients Like Me, and it is a social network, and it's set up for people who are living with health conditions to be able to socialize and talk with other people who have the same condition as them, who are living with those same conditions. And in its initial conception, it was about actually just being able to meet people. So I think actually the founders, I want to say it was his brother was diagnosed with ALS, and he wanted to talk with other people with ALS, and that's where it sort of emerged from. But now actually, if you go to Patients Like Me, what you'll see is that they have community groups, these communities of interest around a wide range of conditions. And within that, these sort of forums, they're a real mix, from anything from people sort of exchanging tips and ideas on how to cope with and manage with a condition, talking about, this idea of up and coming research, things that look promising, right through to groups that are also themselves driving their own research studies and doing their own research studies. And when I first heard about this, I was blown away at this idea of these sort of genuinely patient-led researchers, not talking about co-design, not just talking about that sort of fair weather involvement of participants without really meaning it. This is genuinely communities themselves getting together and going beyond just an N of one study, and actually trying to organize themselves collectively to conduct new studies and research and do trials. And the really cool thing as well with this is that space has become this nice boundary where also these groups are engaging and working with researchers who are helping them to publish and get that message out there as well. So this idea of it not just being something that's happening in isolation, it's not just about that community understand these things as well, but actually they're using this as a way to then publish and produce new knowledge, and to challenge actually some of the things that are going on elsewhere. And I think there are some great examples of them, getting their hands on medications for particular conditions and drugs, and showing that actually that the lab studies that were conducted were nonsense, that actually the reality is this is the data. So really fantastic, definitely worth reading their story. What's really cool here is that, and I say was inspiring with this, was the fact that the strategies that people were taking. So if you read into some of the forums, what you're hearing about is these sort of ingenious sort of make, do, and mend appropriations of how they were making do with what was available to them on hand. So this wasn't a group of technologists who were in here who had sort of just decided they were going to do stuff. Some of these were just people who themselves were motivated and interested, and thought that they could sort of cobble together some aspects that they would need in order to conduct that research. And that's a generalization, because there are other examples where they have got precision built tools that they're using as well, and it's very sophisticated, that relationship. But there are a lot of examples where it's grown from nothing. It's grown from that interest and that itch and that desire, and from somebody being motivated enough to sort of find solutions and just find other things out there that they could join together. And some of those examples were them using existing bits of technology, things off the shelf that they could use to an extent, or creating their own sort of questionnaires on things like Google Forms and other sort of online services as well. And what's been really amazing, as I say, is that it's grown from this idea of self-experimentation and people talking about what worked for them and what they did, to them actively sort of starting to challenge and produce then sort of research outcomes, using what tools were available to them, then working with researchers to try and increase their capacity in terms of how they might have analysed that data, or how they also then publish and get that information out there. So this idea of those sort of collaborations that take place as well, that bringing new capacities into that community, it's a different way of working for us as researchers, because actually we're, instead of being in the driver's seat and setting our agenda, the idea is that we really are, the passenger along for the ride that's hopefully trying to sort of pay their way and demonstrate their value and support then the agenda of those individuals. And this excites me to no end. This is fascinating. Being somebody who's lived with a condition and for years talked about how actually when the weather's bad, my joints definitely feel worse, and then not seen any research being done on that. Okay, there's been some sense, but this idea that actually the sort of communities out there of people who are talking about these things, and yet they're not getting attention. Researchers are not funding those things, and they're not spending time on it. So actually they've started doing it for themselves, and that's what's quite exciting here. And I say the other really interesting with that relationship as well is how they viewed then the universities and the researchers. So framing us more as a service as opposed to what we typically have, which is us taking from participants. So this idea of what capacity can researchers bring. So we bring that trust, that authority, then that sort of stamp of approval in terms of results that we publish, and therefore it gives them the credibility in terms of the type of work that they're doing. And that credibility is really important, both in the sort of types of tooling and the activities that they use, but also in the way that the sort of results are communicated as well. So the light bulb for me as well was, okay, can we then, can I dedicate myself for the next 30 years or however long it takes for me to hit retirement age, to basically create better tools and processes then to help people like this to do this type of work, this type of research, and is that then the framing of what a democratized healthcare technology needs to be, and that agenda needs to be around not just satisfying what I'm interested in, but as I say, this idea of how we really open the floodgates for this type of behavior en masse. And so can we help them achieve that? Other source of inspiration then, so this is a really neat open source project. So this is called Gadget Bridge. You've maybe used it yourself. So a lot of the studies we were seeing in the patient study, and a lot of stuff we were hearing from participants in conversations, was around how they were using sort of personal tracker devices. You had limited access as to what you could get out of those, and if you didn't know software engineering, you couldn't sort of work with the sort of building apps to do things. It was really difficult for you to get at that data, and you were sort of limited in what you could extract from some of the online services. That's changed a little bit now, that landscape, but at the time of sort of Gadget Bridge being created, that's what they were trying to tackle and address. So what they have is this amazing open source application, so you can poke around and use the source. But their mission was around actually allowing people to really unlock and access the data from their personal wearable devices. So the intention here was that they could get access to that raw data and raw information from it. And this is really, really important, because it means then that instead of you being sort of restricted and limited by the sort of summaries analysis that you're provided by companies like Fitbit or I don't know, the Jawbone and those other sort of fitness trackers, Qband and whatnot, instead of being limited by them and restricted by them in terms of where your data goes and what you have access to, you would have access then to the sort of raw source. Well, I say raw, the sort of computed values from that wearable device that you could use for your own intention and purposes as well. This is great, in terms of this, as long as you have a smartphone, you could sort of talk to that wearable device and you could extract the data from it and use this. So this was ideal then for people wanting to sort of do studies, maybe relating to physical activity and movement. They had a way now of accessing this data. The challenge comes now when actually the sort of the design of the wearable, so here we have this ability of this sort of flexible smartphone application that can talk to this and do other things with the data and give us more close access to that data. But actually, what if the wearable itself isn't really recording the data that we need, or in the form that we need, or communicating things in a way that actually are useful to us? At that point, we're limited, and this is a sort of limitation of Gadget Bridge, in that actually what it allows you to do is access the information, but you're still at the mercy of the algorithm that's been predefined by Pebble or Qband or Amazfit. Whatever's running on that is kind of what you get. So point to some other work. So this is in contrast to that. There's some really neat work that's been going on in Carnegie Mellon University. So Patrick Carrington and his team there have been exploring this idea of wearable devices that are sort of bespoke then to wheelchair athletes. So recognizing that actually a Fitbit that tells you steps is meaningless to a wheelchair athlete, and actually isn't really going to give them anything of value in order to understand their performance and how they can improve in terms of their sport. He and the team worked very closely with wheelchair athletes to rethink and design, as I say, a wearable or a sort of embedded technology that could be used by that community then to better understand their physical performance and movement as well. So what they've created, as I say, is this new technology that can be attached then to the wheelchair itself, and using the same types of sensors but running a completely different set of algorithms. They're able to compute then values that are meaningful and interesting then to those individuals. So rather than being interested in step counts, they may be interested actually in those sort of acceleration, deceleration of movement. Yeah, so much more interested in things that are connected with then the way that they live their lives and the types of behaviours that they have, rather than as forcing, as I say, this sort of predefined algorithm that's designed to cater for the sort of mass majority. What they were looking at was sort of, could they design these sort of bespoke visualizations and compute values then that are of interest to that community. And again, you might be saying, okay, well, that's in this sort of niche long tail of technology, you know, in terms of wheelchair athletes, you know, and anything sort of targeting that, athletes in themselves are probably in that sort of niche community. So therefore, you know, what's the broad appeal? And actually, that's what's really been quite exciting about this, is that the work has continued, and since then they've been exploring actually, well, how might these values be meaningful to wheelchair users in everyday life as well. So in the same way that, you know, we saw these wearable sensors initially being targeted at, again, athletes for high performance refinement in terms of the way we do sport, to now be in these sort of cheap consumer devices that we have that nag us all the time to move and do things. Well, there's the same potential and opportunity here for this bespoke piece of hardware that they've created. So what's interesting here is that they've sort of opened up this other potential avenue or route for this thing to be sort of scalable and potentially something that might be a sort of long-term viable solution. The thing I will say is I've not been able to find out if this is an open source hardware project technology. I couldn't really find anything on it. Maybe others have heard of it and might know, but I wasn't able to find anything where I could access it. But as I say, this approach of creating that bespoke technology is an interesting one. The danger or the challenges with this, though, is obviously is the high-end costs associated with that. And as I've mentioned before, that struggle of how you transition through that sort of prototype to actually having then a product or service that you ship. So I'm going to now talk about some of the work that I wasn't directly involved in, but actually the team that I'm working with, this work predates me actually. It's just before I joined Newcastle University Open Lab. And this is the sort of foundations for the case study in the project I'll talk about today as well. So PDQ was a project that was led by Roisin McNanny, who's now at Monash University. She was at Open Lab at the time. And this grew out of activities that she and her colleagues had been doing with local Parkinson support groups. So they had been exploring actually through co-design, participatory design, possible uses of existing digital technologies. So they played with things like wearables like Google Glass. They looked at things that were in sort of speech recognition. Being a speech and language therapist herself by background, they explored a lot of stuff around that. And they were interested to understand, where and how people with Parkinson saw these technologies having value in their lives, if at all, and then equally trying to understand some of the challenges that they were experiencing. And one of the things that came up across a number of these support groups was this idea that actually a real social challenge for them was actually around related to swallowing and drooling. So you might not realize I'm definitely doing a lot of it now because I'm talking loads, but you produce a lot of saliva throughout the day, and you have a sort of automatic response that allows you then to sort of swallow that saliva. Saliva is really important in terms of your sort of hygiene of your mouth. The challenges we see then in some people with Parkinson's, and quite a high population experience this symptom, is that actually that cue, that automatic response to swallow, sometimes the body doesn't send that and they don't do these. And then as a result, what can happen is the sort of pooling of saliva in the mouth. And this can then have one of two outcomes. So one is that it might cause sort of drooling, so the sort of external visibility then of saliva drooling down your face, which would be quite embarrassing, particularly in social context. The other side as well is potentially even that choking, this idea of it going back down another way and causing a sort of choking as well. So this was a problem that a number of people in these support groups talked about. And there wasn't a whole lot of research going on in it. There was some interventions. So there was sort of more invasive treatments that existed. So treatments that would actually reduce and inhibit then the production of saliva as a way to reduce then the symptom. So the sort of the nice sort of I guess a healthcare solution to this was, we'll just stop saliva production and then there will be no more drooling. The trouble with that then is that if you stop saliva, you start to impact on other things. So as I say, it causes problems for the health and the hygiene of the mouth. And again, that sort of dryness of mouth can be uncomfortable in its own right. Yes, okay, I'm not physically drooling, but actually I now experience these other symptoms. My quality of life is still inhibited by this. So what was interesting is the group were interested to explore, could there be a device or a wearable to help with this? And if so, what could it do? So they worked, and actually a lot of this idea and the ideation came from these participants themselves. So they really, spec'd out this idea of having a technology that told them when to swallow. So could it vibrate and tell them when it was time to swallow? So what the team worked on is they developed then this bespoke piece of hardware. So OpenLab had a long history of making these sort of wearable and embedded devices. So what they did is they sort of created this all entirely in the lab. So that's a 3D printed enclosure. They're using off-the-shelf aftermarket sort of straps that are attached to that. So everything was sort of designed to sort of fit within those tolerances. And then the PCB, they sort of hand soldered in the labs themselves as well. And what they had was a device then that had a button that allowed you to turn it on, and it would periodically then vibrate, and it would give that cue to somebody to tell them to swallow, and then it would stop, and then it would vibrate every time it was time for them to swallow. And then when they no longer needed the intervention, they could turn it off. And that was the design of the wearable. So this first study was all conducted in sort of lab conditions where people would sort of use the device for a short period of time. And what the team were able to show is that actually this is an effective intervention. This is a useful way of doing things, and that actually the cue that was being delivered was sufficient then that they were able to swallow and reduce the symptoms of drooling. So from that point of view, it was a good success. The challenge then came around actually how they transitioned from this prototype into actually thinking about this. Sorry. 2 seconds here. I think that might be my builders. Can I get? I'll ask you to wing for me now, Tiago, if that's all right. I'll be 2 seconds here.
Well, maybe I'll sing. Let's wait a little bit for Kyle. Well, I won't sing. I may tell you that the problem here was obviously that people then wanted to appropriate this and change the type of cues and the type of vibration that they would receive, or pause it in some of the times, and this was completely closed, and so they didn't have any way to change those and to create more complex ways of interacting with these cues. And then, well, slide is over, so I can't tell you what's next.
That was fun. Apologies.
I sang a little bit, so you can continue.
Oh, good. Okay, well. Yes, so the challenge came then around actually how we transitioned from this prototype that we're making by hand in the lab to then thinking actually how do you scale this up to be a sensible solution. So this cost, I think the sort of raw components of the parts at the time, we're looking at, I want to say maybe £100, £150 to produce this device, a very, very simple device that had a battery, a vibrotactile motor, and a button. So it's quite an expensive solution to this, and as I say, there wasn't necessarily a clear path as to how this would scale up. And this became, as I say, this sort of project that sat in the background, and the thing that when I joined the lab and started talking with the groups that we sort of kept looking back at and try to revisit. And this was, as I say, the sort of start of some of the discussions as well with Tiago at that point. And we were very lucky that actually one of the things that came up around about that time was there was then a call that was announced from Parkinson's UK. And what they were interested in is they wanted these non-drug approaches. So they were interested to understand actually how you could use digital technologies to support people with Parkinson's and address concerns, so quality of life concerns, or looked at actually how you might support provide social support. So there's a sort of wide range for this. And this became then an opportunity for us now to, instead of sort of working on some of the stuff in the background, to actually think about, right, well, let's try and get some focused funding around this to try and transition from this prototype we had of this PDQ device into something then that actually we could get into the hands of people with Parkinson's. So what we wrote was this proposal to run an 18-month study, which we're in at the moment. We said that we would produce 3,000 of these devices, and that we would involve people with Parkinson's in the sort of deployment and sort of design alongside that of this technology. And then we would evaluate then this wearable queuing evaluation in the wild. So instead of doing it in a lab setting, we do this in the wild. And the other big commitment we made as well is that everything we did, we would make open source. And what we had in our heads was not just that we wanted to make it available so that researchers could access it. We wanted to be at the point where actually this could be something that could exist then as a product. We would find ways then that we could connect up those sort of streams to allow this to be a possible technology and tool that could exist beyond the funding that we had for those 18 months. And could this become then a platform that the people with Parkinson's themselves could build on and use for other things? Could it be something that future researchers might engage with and use? So could we create then this sort of democratized healthcare technology as the start then for something different and something new? And as I say, that's the sort of the big pitch that we went to, and you know what we said that the technology do. So the purpose we gave it was around this idea of managing those drooling symptoms, trying to find a way of doing that in a very sort of discreet and socially acceptable way. And the other thing was around making this accessible to people. So making this something that could be available. So it couldn't have a really expensive price tag. So as I say, that was our sort of focus for this. And luckily, Parkinson's UK were really on board with this, which has been great. So it's successfully been funded. In terms of the people involved in this project, so as I said before, we work very collaboratively. So in addition to working with Tiago and Andre, and I see Ugo online as well, and our advisory board, and Diogo Branco is involved as well. You know, from the Lazish Research Group, as well as that, we've got collaborators in Newcastle University, Northumbria University with me, and then we also work with a special interest group called Digital Parkinson's. So these are people who are living with Parkinson's disease, who themselves are also technologists and like to sort of, they've got an interest in technology. So some of the group, you know, have backgrounds in companies like Siemens, you know, and have done things with wearables, embedded technologies, or AI, machine learning as well. So it's a really interesting team around this. In addition to that, so I realize I haven't put on, so there's an NHS Trust, so our National Healthcare Trust. And as I say, the plan for the project is to have this be a national thing. So we're doing the whole study as remote. We're posting these devices out to people. The apps will be available in the store. And the idea is that the study all happens in the real world, which is really exciting. And although we've recruited 3,000, we're going to recruit 3,000 people for this, the actual intervention part of the study is only on 300. So the wider 2,700 are really there to play with and experiment and think about new innovation and ideas for this technology, this device, and for them to really get their hands on with this. And that's something that, you know, you don't normally get to do and early on in this design process, where there's still scope to change what might then become a sort of product or service. So that was the sort of fun part with this one. So a large amount of time had passed from that first PDQ project where we sort of made the devices to then the sort of conception of this new one and these devices. One of the things we were looking at was this next generation of these wearable devices. So I think the original project took place in sort of 2016, and then we were looking then in, I think, 2019 it must have been when we started looking again at these new devices. And what we came across were these nice sort of cheap, low-cost devices. The PCBs themselves were being manufactured in China, so we weren't doing this ourselves manually in-house. We were talking with some of the manufacturers at the time around how we could potentially leverage some of their existing tooling and molding. So the sort of tooling around how they sort of print and create those casings, how they make sure that they sort of secure them with waterproof and things. That typically is additional cost that you incur, and you have to go through, you know, extensive design process for that. So it's not just actually designing the onboard PCB, it's also making sure that everything else around that product, right down to the strap and the charging cable, all actually have the right tooling and whatnot that are needed. And you know, you're talking thousands of pounds to produce that, even before you've even thought about getting the sort of certifications, the CE marks and whatnot on these devices as well. So the barrier then to sort of getting from what is an open source design that we've been able to demonstrate that works, and is entirely feasible and has the performance we need, to actually get into something that we could ship and safely provide to people. There's all these huge other steps that are in there that we as researchers don't normally sort of have to deal with, but this was part of our project now. So what we were interested in is could we approach this in the same way that we approached software technology? So rather than saying we're going to build the whole thing from scratch, could we sort of take advantage of any of the elements that might have been open and available to us? So in the conversations with this manufacturer, what we agreed was that we could sort of take it, if we changed the form factor of our PCB, we could potentially use an existing design they had around the sort of molding and how they were producing things, and that was one way of bringing down the cost. So what we had gone and what we managed to do then was to get a device that had the sort of specifications that you see on screen. So in addition to having the sort of vibrotactile motor, we now have accelerometer that gives us quite detailed understanding of movement. We've got Bluetooth 4.0, which was at the time great. BLE, we had LEDs on there, so we could do a little bit of communication to the interface. Much better battery life as well, so 30 days battery. That would have gone down when you start to use the vibrotactile motor a bit more, but in terms of the sort of device, it sort of touted that. Because it had Bluetooth and the bootloader was open, we could also reprogram it, which was really great for us, because it meant then that the firmware on top of the device was flexible and we could change that. So if we had to make a change in the study, we could update that. Likewise, if we come up with some new ideas for what we could do with the device, we could change that on the device. So it wasn't that this was printed on a device and immutable. We had access to change that. And the bit that made us really happy was the price, the cost. So we had managed to get the costs right down. So by approaching in this way, we'd managed to bring the cost down to sub £20 at the time. So these are 2020 costs. Pandemic and chip shortages have probably changed things a lot. So I wouldn't quote me on what those would have been now if we'd gone down that route, but we didn't, unfortunately. So one of the things that happened is we did some test runs with this, and we were doing some of the early development. And because of the relationship we had, where we were sort of borrowing and using their existing plans for things, anytime we did a new batch, a new order that was sent to us, there was always subtle differences in changes made to the device. So it might have been the sort of placement of something, something couldn't fit the same way it did. The strap came back different one time, the charging cradle was different. And this was because, much in the way that if you use an external API or service, if that person changes that API, then you need to accommodate and adapt to that as well. The old one still doesn't exist. So we were seeing the same thing in terms of our approach to the hardware, is that because they were sort of making these changes, we were then being susceptible to that downstream. So this was problematic and risky. And what we quickly realized is that we couldn't guarantee then this as a sort of long-term solution. We could probably buy enough devices now and could have got enough working for the study, but our vision of having that sustainable product and something that extends beyond the project wouldn't have made sense. It wouldn't have worked. And all it would have taken as well for this manufacturer to turn around and say, right, we no longer want to support this type of project. And then all of a sudden we wouldn't be able to do anything. So this this put a dent in things. But not before we did some other work, actually. I should say this was some other interesting stuff that was valuable. So I mentioned before about the sort of credibility of what we were doing. By having this cheap hardware, what we didn't want is for people to write it off. So if any of our people with Parkinson's did studies, we wanted then that data to be meaningful. So one of the things that the team did, both here in Newcastle, but also Tiago and the group in Portugal as well, is we conducted sensor validation studies as well. So we did signal response, and then there was also the sort of traditional sit to walk stand test as well. So collected data where we compared these cheap wearable devices, these sort of consumer technologies, to what were at the time the sort of gold standard physical activity monitoring devices that costed maybe around £160, so significantly more than the price of the sensor we're getting. And what we found here is that actually they were comparable. So that was really exciting, was that not only was this a cheap sensor that would have been sort of really good for our project and could be used, it also could achieve comparable results to what is the gold standard in physical activity movement. So that was exciting for this as a research platform. And in fact, I think Diogo might have already presented some of this at the series and some of the data park stuff as well. So I'll not even go into any of that. I'll just keep quiet. So it was looking bleak in terms of, despite our best efforts, we couldn't secure a sort of a useful manufacturing process for this device. The test runs were always inconsistent, and then, as I say, we had issues around then that sort of relationship with the manufacturer sort of refusing to sort of guarantee a consistent production then for these for us. So what we started to do then was to look around and see, well, if we can't if we can't build our own and sort of use those existing components and do it, is there then an existing technology that might be open enough that would allow us then to sort of put our firmware onto it? So can we take advantage of the fact that the software is nice and flexible, find a device that has a comparable set of hardware that would allow us then to do that? And as luck would have it, we found this really nice device. It's called an i5 activity band. Very similar form factor to what we had. This one actually had the addition of a screen, which was nice. And we actually could, what was even cooler is we didn't go to a manufacturer to find these. Instead, we went straight to Amazon and we just found random bands that we ordered a bunch of them. And we basically tried to see if we could reverse engineer them and tinker with them. And this one here, the bootloader in it wasn't locked down, which meant that we could imprint our firmware on it. And it was very easy for us to get it up and running again, which meant that we had that flexibility on the device. And what this meant is, in theory, if somebody bought this device from Amazon, they could load our software onto it and they could do it. So now we, in theory, had this sort of sustainable pipeline. So not only did we have a device that could work, we had a way then that we could give people access to this in the future and allow them to do the same as well, which was great. We tried to negotiate some terms with the manufacturer of these to do a bulk order and large scale and get our stuff imprinted on it and things as well, and equally to try and secure a sort of long-term pipeline, because this wasn't an open source piece of hardware. It just so happened that we could sort of tinker with it, but we didn't get any further with that. And then we did some looking around again, and what we arrived at is this, and I'm happy to tell you this is the one that we're going with, not least because we've already ordered 1,250 of them and they're here, and there's another 2,000 coming. But this is also the perfect project for us. So Pine 64, if you've never heard of them, they're a really great community. So they do these exciting open source projects. So they do things from smartphones, tablets, like Raspberry Pi alternatives, and they also do this amazing smartwatch, this wearable. And what's really cool about this is it had the things we needed. In addition to it, it had some other cool sensors. There were some compromises. So you'll see here the sort of biggest one being the sort of battery life, by having this sort of different type of display on it. But that was a compromise that we could live with. What it did bring to the table, though, is that we had a community that was already there. We had an open source design that we could get manufactured in the future if they stopped making them. And we had, as I say, a process for how we could build on top of this and make it work for our community as well. Tiago, I'm conscious of time here. How am I looking?
Well, we are getting to the end of the seminar, but we would like to hear the rest.
Oh, okay. Well, I'll be quick then. I'll skip on then. So in terms of the study then, so we have our device. We're now using, as I say, this open source hardware. We're building on top of that. We're contributing back into that main community as well. So we're building on top of their Infinitime open one, and we're contributing. It's a little bit more expensive than we'd first planned, but that's fine. As I say, we in terms of this, we'll still need to do the signal validation for the sensors to make sure that this is on par. But we're fairly confident it's the same actual components at the low level that's in these as well. So it should be fine. But yeah, so for all intents and purposes, this was the perfect device for us. It comes stamped with all the necessary legal paperwork it needs in order to be distributed, not only here in the UK, but globally, which is exciting. And we have, as I say, negotiated terms to be able to access in bulk, but also for individuals to be able to buy single devices as well in the future, which is fantastic. And this brings us then to the Qband project and where we are today then. So this is, as I say, what this has sort of evolved into is this Qband Wearables for Parkinson's project. And this is what we've been funded to do. So what we have is this intervention trial plus. So we're doing our intervention of the wearable versus then a sort of mobile queuing system, which is the current state of the art and available technology for people in this space. We're doing this as a large-scale validation then of that queuing method in itself, because that hasn't been done yet. Previously, it's only been done in lab settings. And then we're also going to explore then the addition of being able to think about and schedule queuing. So this idea of can you think of queuing similar to the way we think of our heating schedules or lighting schedules? So can somebody have a device that intervenes at that moment without them needing to think about it as well? And there's some interest from the AI researchers working on the team who are interested to say, okay, can we infer that type of behavior as well in the future? So some interest around this sort of scheduling. And then the other big part of this, as I say, is that idea of generating new ideas and excitement around what this technology might do in the future. So that's why we've got that extended 2,700 people involved in the project to hopefully come up with new things. So in terms of the way the relationship works, we have a smartphone app that we talk to the mobile phone. For the study, that's required, but in the future, that the phone should work, the watch should work standalone. And in fact, you can use even the Bluetooth from your computer to program and set it up. So you can just open a web browser and do all that, which means that actually this technology doesn't mean you need to go and buy £1,000 mobile phone. You could buy a £20 or £25 band, and that could be your intervention. And so we've got some nice ideas around how that works in the future as well. In terms of the study, these two paths I mentioned before, we've got the intervention trial. We'll be doing various questionnaires and surveys along the way, and then we have this other group who are just sort of free living and using the device and giving us feedback on that as well and their experiences. And then what we also have is the apps are going to be in the source for free. So if anyone wants to use it and doesn't want to be involved in the study, they'll still be able to download the app and use it and buy one of these devices for themselves and still use it. So that is that we're making it available. So we're doing it different. Where normally you would do the research, and then eventually you would figure out the pipeline and get a product. But we're saying, right, we're doing it all together at once. We're just going to put it all out there and be open about the fact that this is a platform that we want to build on and experiment on. So yeah, I'll try and distill into some meaningful things for you, and I'll stop because I'm way over. So in terms of this democratizing healthcare technology, so what we need to be doing is providing opportunities for patients to have meaningful input much earlier in those design processes and throughout that design and development process. So in order to do that, we need to create those tools and enable the access that they're going to need in order to change, adapt, and extend our digital technologies in these healthcare interventions. And then finally, we want to consider, as I say, that longevity. So it's not enough to think about your healthcare intervention and what you can prove today to researchers, but actually, can we, from the point of inception, think about this as being that sort of long-term commitment and relationship that somebody's going to make to your technology as well. So once again, I'd like to thank and acknowledge my many collaborators involved in this work. Some are in this room. It honestly wouldn't happen without the team. I do very little by comparison. So thank you.
Thank you, Kyle.
Happily take questions.
Thank you very much. I will clap on behalf of everyone. Thank you very much for the presentation. I really enjoyed it. You see some claps on the audience. It's good to see your what I say is a different perspective, and I think it opens and thinking about hardware as people think of software. I think it's a very powerful concept that allows you to think about appropriating these technologies. So now questions. Who has questions for Kyle?
Apologies as well for the disruption partway through.
I can maybe ask one.
Go ahead.
So my question is about the whole democratizing healthcare. Are we not somehow also making people more accountable for their health and their health management by doing so? And if so, what are the consequences for people who don't want to engage and would like more of a transactional model?
Yeah, great comment. And I would argue we've already done that, particularly when you look at chronic conditions, these lifelong conditions. The vast majority of those already put those individuals in the driving seat, this expectation on them to do everything they can to manage. And then with that, certainly in the UK, I'm sure it's different in other places, the support that's available isn't being provisioned by our primary healthcare. Now, organizations like Parkinson's UK are charitable organizations that are filling the gaps. So these are sort of support groups that are run by volunteers. So in many ways, the healthcare support for chronic conditions in particular, we already have put that burden on the individual because it's not sustainable for us as a healthcare to do it internally. So I think what we're talking about here is actually trying to do more to support them managing with the responsibilities, the burden they've already got, and looking at ways that we might help them to be more effective in what they're already doing. And then to speak to your comment as well about the fact that some might be resistant to this, absolutely. And I think I don't take that lightly. And in fact, your own work, Andrea, around people being forced and migrated into smartphone technologies and non-visual interactions, the challenges around that. We're going to see the same in spades around using healthcare technologies, that resistance. I think the thing we need here is just around actually those relationships that we build up and those the sort of organizations like Parkinson's UK who should be the actors then that are sort of helping and supporting that and already provide some of that support already. And if you look at the sort of the way that they're structured, they have these sort of regional networks across the UK, and I'm sure it's the same for other countries as well. And that support is within those sort of hyper local views. It's not something that's been centrally rolled out. It's something that's done on a very local capacity. So I think what we need is those strategic relationships with them, and to think about our technologies as not just being one-to-one relationship, me to the customer, or that naive vision of a healthcare professional to their patient, but instead thinking about those complex relationships and support that people get through other spheres and other sort of constellations as well.
Thank you.
Other questions? So I have one related, so I will ask it while people think of other questions. So if I talk to a physician, people say, yeah, people go to Google and think they know everything, and then this creates a lot of problems. So I've heard my wife talking about this, that it creates a lot of anxiety. People think they have all the illnesses just because they use a search engine. So I was here listening to you, and I thought this in the past as well. So if we talk to some clinicians about these approaches, what are the reactions, and how is their view? And I know that probably in some cases can be against what you are trying to go towards here. And the other thing is, how is then possible to then have these good collaborations that I see that you have in this, that we have in this project, for example, where we are doing the same thing, the two things at the same time. So we are working towards more, I would say, a clinical study, but also at the same time enabling this appropriation and this democratization. So can you tell us a little bit about that, and how you see these challenges and a little bit confrontations?
Yeah. So I think that sort of tension around then, the individual becoming an expert through Google. I fully appreciate that one, without a doubt. I think what we hope to try and achieve this, and I guess the intention as well around a lot of these health applications, for people to download and use on their smartphones and whatnot, is around actually that individual being a bit more better informed about themselves, and providing them with potentially a boundary object that they can use to support themselves in some of those discussions. I would argue that it's certainly in the UK we're seeing a lot more of this around that sort of social prescribing and prescription of technologies and apps and things, outside of even just the sort of research trials, actually as part of these sort of the sort of mainstream delivery of our healthcare, and even our NHS, building and creating their own applications around it. So we're seeing more and more push towards that. I think that the challenge we've got with these is that they're built with a particular agenda in mind, and it doesn't necessarily sort of map to the interest then of those individuals, those users. I think what we will have, and what we'll hopefully see in the future, is more of a discussion around actually how these things start to integrate. And I know there has been some work in this in the past, where people have looked at these sort of technology mediated clinical appointments, and this is as I say, not a sort of new space, but it's one that we need to tread into again. But actually, can we go in there not with a device then that has been prescribed by the healthcare researcher, where they themselves have the power and they bring that individual in, where that power dynamic still exists as well, to then talk at them about their results, but actually, can we do it in a way where there's a bit more of a level playing field, and where that individual is recognized and valued as being an expert in their own health? Because we trust them enough to manage their condition without us. We send them off into the wild and we'll say we'll see you in 6 months. So we should be able to trust them to be able to understand and interpret then the sort of data that they're coming through, and to have a sensible conversation with them. A cheat's answer is I don't know yet, Tiago. I definitely think that this is it's going to turn heads, and it's going to be met with some tension, without a doubt. And I think it's going to be interesting as well, particularly when you start to think that will these groups start to sort of challenge and contest the things that we're seeing, much in the way that Patients Like Me did the same, where they challenged and contested those papers that have been published in the sort of drug trials. But equally, I would argue that might be then a role for us. You know, we talk a lot about, and I see Ugo's hand up as well, so I'll talk about these sort of universities as a service, and this idea then of actually what's the capacity that we as institutions and we as researchers might bring in mediating those relationships as well. So can we provide the tools that provide that trustworthy information, as opposed to it being bad information they might find in Google? Can we provide then the tools and infrastructures that better support that mediation and that discussion? So yeah, I think there's a lot of work still to be done in that space. And I'm sure AI is going to fall into that at some point as well. It's been an interesting one there. You know, so at what point, you know, do we need to care? It's not an opinion of Google, it's an opinion of the same AI that the GP was going to use anyway. You know, so there might actually become a point that, you know, it's a moot point. But yeah, waffle dancer. Sorry.
Ugo, no, that's great. Thank you, Ugo. Go ahead.
I'm not sure how you guessed my question, but yeah. So thank you for the talk. Very, very cool work. So my question is actually related with this idea of having the university as a service, or research as a service for that matter, and how you actually engage with individuals and communities and build long-term relationship with them. So my question is twofold. So the first one is, what are your current approaches or strategies to maintain this relationships, which is something that it's not easy to do? And the second one is more on the ethical implications of this, particularly when you leave out. So projects end, and sometimes you need to end relationships as well, or at least not engage as much with those communities. So what are your thoughts on this? How can we do this in an ethical way? Yeah.
Thanks for the nice, straightforward, easy question, Ugo. Much appreciated. No, I think it's a fantastic question, and definitely one that I think this project in particular, we really rattled ourselves trying to come up with a sensible approach and strategy to this. So you know, in terms of this idea then of you know, if we take the sort of university as a service one, you know, this is one that, yeah, I definitely think, you know, we need to see more examples of that. All too often, a lot of the research that we see coming out, and again, this is not a criticism of anyone, this is just the way research was done, is that it's taking from people. You know, we work with people in order to satisfy our needs. One of the things that we've tried to sort of do in this work and in previous works, you know, it's taking the sort of digital civics approach, is actually looking more at this idea of the value of capacity that we as researchers might bring, and what is the value that that research might bring to those individuals or those communities. And as a result, the methodology that we use, the approach we take, is very different. So a lot of the time we're talking about sort of action-based research, where we're not going in with the promise of a cure in 10 years or 20 years or beyond. We're thinking, actually, yeah, that might be the long-term goal, but what are some immediate benefits that you will experience today as well? And you know, I think the easy way to look at, you know, are you bringing benefits to your participants, is to take a look at your information sheet, and in that section where it asks what are the benefits of the research, if all you've written in there is that, you know, people enjoy taking part of research, then actually you're probably not bringing enough value to the table here. So as I say, we were very critical of ourselves for this, and I think that's why this project in particular, one of the things, and the reason for doing two things at once, is that we're fairly confident in the intervention from the lab study, and we believe that it'll bring value, you know, from the conversations we've had with people through these support groups. So we saw then there was a need for a technology to exist, an immediate benefit that we could potentially bring to this population. And you know, if it turns out that actually that technology isn't more effective than the smartphone device, it still potentially brings something to the table. They maybe didn't have that smartphone device, or they maybe weren't using it for that purpose. So I think from that point of view, with this one, we looked at it and said, right, that's the immediate benefit. We also saw this as a potential seed to start other things. So by making it something that was theirs, the design of the technology as well puts the data in their ownership and control. What we've tried to set up is the ability for them in the future to have a bit more power and agency in future conversations about research that might happen either within their community or as they interact with other researchers as well. And I think that's that transformation that we're going to see everywhere around this relationship, and that university as a service, is that actually we're not just going to be the ones that are going to take anymore. We need to be a bit more relational in the way that we work. And then to go back to the other one around actually when the project ends and we disappear, and I kind of hinted at that. So one of the things that we wanted was to make sure that actually it wasn't just us. So the partners we've involved, the Digital Parkinson's Group, are a group of individuals who live with this condition who are committed to this, and they will always be committed to this, and they are a strong community of people who are interested in working in this. Parkinson's UK themselves are this huge charitable organization that are basically fighting for people with Parkinson's, both to try and find a cure, but also looking at those everyday solutions. And they provide this amazing support infrastructure. So again, they're an amazing actor. So what we've done is we've tried to make sure that we've aligned ourselves in our research with them, and provisioning then that exit strategy from the start. I want to stay involved in this, even when there isn't the funding, you know, and testament to the early stages, working with you and Tiago and Andrea and Diogo. When we weren't funded, you know, we're passionate about this, but equally I recognize that there needs to be somebody who is at the helm. So what we've agreed and what we've set up as part of the project is that at the end of those 18 months, we sign over the apps and the technology all to Parkinson's UK. So though it's open source, the ones that are rolled out at the moment, they have control, they have access to all the keys of the kingdom. So it becomes theirs. And then we are then still involved, but on the outside, and the hope then is that that's a commitment then for them to do more with it as well. And that's the way we've sort of built it and talked about it with them and what we wrote into the grant. So I think that's the other strategy you need is not necessarily taking the role in building that capacity within a community, but this idea of trying to level up that community and recognizing that when you step back, there is a void and there needs to be somebody that fills that role. And that negotiation, the earlier you can have that and the more you think about that, the better your possibility then of sustaining these things. I think I got them all, hopefully. Cheers.
Okay, everyone, thank you so much for coming, and thank you, Kyle, for the interesting talk and the response to the questions. I look forward to seeing the outcomes of this project.
Me too.
Cheers.
Good. Thank you very much,
everyone.
guys. Bye.
We have another seminar next week, so stay tuned. See ya.